Has someone diagnosed you with sciatica?
I'm going to tell you why it's not as scary as you might think. Tune in to the 50 Shades of Pain show. Hi, everybody. Welcome to the 50 Shades of Pain show. I'm Dr. Donish. I'm here with my co-host.
Dr. Escaloni?
We're welcoming everybody to the 50 Shades of Pain show, where we empower our community with knowledge about your body, pain, both mental and physical, and how you can take better control of your health in a more proactive way. So today we're talking about sciatica. And what I often tell patients is sciatica is a dump bucket diagnosis, meaning that there's maybe 24 different things that could present with the complaints people usually label as sciatica, but it's really a wide number of different conditions. And why that's important is because unless you have a diagnosis that really gives you a solid treatment plan, it's not a useful diagnosis. It's really just a complaint. And sciatica can range from everything from just a minor muscle issue, compressing a nerve for pressing down on a nerve, all the way up to a catastrophic event in your spine that runs the risk of paralysis and loss of function and stuff. Now, what do you think is more common?
Hmm. I think the paralysis and death that you mentioned a second ago, right?
It's like 0.0002% of all complaints. Like
Um,
it's exceedingly rare. You have a better chance of being struck by a meteor than having like that catastrophic event where you're really in danger. Most of the time, sciatica is anything that happens in the pathway of that nerve between the limb and your brain. Anything could cause that same symptom. So it could be something like your piriformis muscle compressing, or if you strain a muscle in your butt, because the nerve, the sciatic nerve runs right underneath that. When that muscle is irritated, it's going to give off a whole bunch of irritants like inflammatory chemicals. It's going to it's going to go into spasm and compress the sciatic nerve. So any one of those things could cause that symptom. If we move up the chain, up the sciatic nerve, you could have issues around where the nerve exits the spinal cord. Like, for instance, if you have arthritis or if you have a disc issue, those things are typically what people think of as sciatica. But it could also be something associated with that nerve. So, for instance, the ligaments in your buttock, the ligaments in your back, any one of those, if you get sprained, you can have the same kind of presentation. So sciatica is often not that scary. In fact, most of the time, it's something very simple that just needs some minor adjustments or tweaking to figure out how to make it go away.
I was kind of wondering earlier when we were talking about preparing for the show, you said, I hate the term sciatica. Now I'm starting to understand a little bit why. It's kind of scary to think about all the things that could go on with it. And most people think of that 0.000002% that they could get.
Well, the reality is when I went through medical school, I had this disproportionate understanding of condition because obviously there are some really important conditions you don't want to miss. If you miss a certain timeline on somebody having a stroke, it's the damage is done. You can't reverse it. So there are certain things that because of the severity of the outcome, we get all this attention around. And then we go into practice thinking these terrible catastrophic events are happening on a daily basis. And I've been practicing for 17 years now. And I can count the number of times I've seen those catastrophic events, and I can even count them on less than one finger. Like it's exceedingly rare. And the number
You've seen thousands of patients.
I've literally seen thousands of patients. And the number of times I've had a patient come in, head hanging low, mopey and depressed because they think that they have this terminal condition in which the end point is sitting in a wheelchair the rest of their life. And the reality is that's such an uncommon thing. And especially if we can see people in the early stages, we can identify the real root cause and start treatment plans that will help address that and fix that. And the symptoms can completely go away. It's not this And I mean, in fact, here's this is just a map. This is from a colleague's book, Simon and Travell, or Travell and Simon. I forget which order the authors come in, but it maps out the different trigger point for myofascial pain patterns, meaning like if muscles become problematic, then people feel the pain in these regions. And if you look at, in particular, piriformis, the tensor fasciae latae, the gluteus minimus, these are just simple examples of specific muscles that will radiate pain in different distributions that mimic that sciatica presentation. All of these are just muscles that share nerve roots along that sciatic highway. And anything that goes off that gives a really loud alarm bell is going to trigger a chain reaction where your body can't really tell where it's coming from, and it feels it in this wider distribution. So these are just muscles. Now you think about there are ligaments, there's joint capsules, there's tendons, like there's a wide spectrum of different tissue injuries that could lead to that sciatica sensation, but they're not necessarily all that catastrophic end of the road nerve root destruction.
One of my favorite patients that I remember that we had over here at Wellward, she was actually wheeled in a wheelchair, had tons of pain, but especially if she tried to get up, tons of pain. And so she got to see Dr. Donish. I remember seeing like, oh my gosh, she's got a tough one today. And I remember seeing her just walking out of that room.
Yeah.
I was blown away and I asked you, where's your wand? All right, did you go to Hogwarts or something? And I think that you had said that.
I did. And I'm Hufflepuff, by the way.
Really?
I don't know.
I would have thought you were Slytherin this whole time. Well, I just still remember you had told me that you were able to teach her after your exam that it really wasn't that catastrophic thing. So all of a sudden she wasn't panicking and you were able to figure out the source of her pain and gave her an injection that day. And she was able to just walk around like, wow, my pain is so much better.
Yeah.
I was blown away by the magic.
That happens all the time, literally all the time. And it's not magic that we make the pain go away. A lot of times it is going to be some work, but people just don't have to live in that dire state of pain or live in in that impression that this is now something they're going to have to live with, or it's going to be a progressive problem that ends up with disability. Like to me, sciatica is like degenerative disc disease. It's not necessarily this catastrophic condition, but we all get the impression it is because in rare instances, surgery is a necessity. And so a lot of patients will come in and say, oh my God, it's incurable because the surgeon said there's no surgery to fix it. And the surgeon is trying to convey this is not as catastrophic of an event that would need surgery. And the patient comes away with the interpretation that, well, if surgery can't fix it, clearly nothing can. And now I'm just broken beyond repair. We see that
Yeah.
all the time.
That reminds me of the other statement that patients say that, well, there's nothing that I can do for you from the surgeon.
Right.
The patient thinks there's nothing that can be done.
Right. Exactly.
Yeah. And they were just trying to emphasize the same thing. I can't do a surgery to fix this.
But there are other treatment sources available.
Yeah. That's amazing how powerful words are.
Yeah, definitely.
Like the word sciatica being a dump bucket term for all these things.
That's right.
Yeah.
That's right. If you've been diagnosed with it, please comment. We love to hear about your story, and we'd love to reassure other people who are dealing with similar symptoms that this might not be something that catastrophic. In fact, more often than not, it is something very simple.
Simple is good.
Yep. Well, join us next time on our 50 Shades of Pain show. Or feel free to comment. Find us on YouTube, on Facebook, on our website, wellwardmed.com. And please feel free to message us as what topics you would like to hear.
Look forward to seeing you guys, and we're hoping you have a fantastic week.
I'm Dr. Donish.
I'm Dr. Escaloni.
We'll see you next time.